All right, so we're diving into another deep dive today, and today we're going to be talking about something kind of tough, but really, really important.
Yeah.
We're going to be talking about breast cancer
Yeah.
and the additional hurdles that so many Black and brown women have to face when they are diagnosed with breast cancer. We're talking about systemic inequalities in healthcare, and this is just a really important conversation to have.
Absolutely.
So we are going to be looking at a segment of Sherletta Denise Germain's The Abundance Blueprint podcast. And specifically, we're going to be focusing on parts 4 and 5 of that episode,
Okay.
where Sherletta talks with some experts about community support
Right.
and really dives into why that's so important in this context.
And, it's interesting because the research actually shows that women who have access to support groups,
Right?
they actually see significant benefits.
Yeah.
Like some studies even show a potential 20% increase in their 5-year survival rate,
Wow.
which is huge, right? But the problem is that Black and brown women often face barriers to even being able to access these groups.
Exactly. And I think that's what makes this so frustrating.
Yeah.
We know that there are these benefits, but then there are these obstacles in place that prevent people from experiencing these benefits. And that's exactly what the source digs into.
Yeah.
It's like, why is this happening?
Right.
And it's not just one simple answer.
Right.
There's this lack of access in a lot of communities. There's cultural stigma surrounding seeking help in the first place. And then even when people do want to seek help, there can be this mistrust
Right.
in the healthcare system itself. I mean, and it makes sense, right?
It does. It does. When you think about the history of the healthcare system and how it's often marginalized and underserved these populations, it's understandable that there's this mistrust.
It's not coming from nowhere.
Yeah, absolutely.
And, when you think about it, facing a cancer diagnosis is already isolating. And then when you add on these barriers to support,
Yeah.
it can just be a really, really difficult and lonely experience.
Absolutely. And that's exactly why culturally specific support groups are so important. That's something that Sherletta highlights a lot. These groups can create, a safe space where women can come together and connect with other women who share similar cultural backgrounds and similar experiences.
Right. So it's not just getting generic advice. It's
Right.
about feeling seen and heard by people who actually understand what you're going through.
Absolutely. It's about feeling like you belong and that you're not alone in this.
Yeah, exactly. And these groups go so much deeper than just emotional support.
Oh,
They also provide practical guidance
Mm-hmm.
tailored to these very specific challenges that these women are facing. So it's about navigating a system that is not always designed with their needs in mind.
Right. It's about, achieving health equity,
Yes.
making sure that everyone has a fair and just opportunity to achieve the best possible health,
Exactly.
regardless of their background or their race.
Exactly. So we've laid out the problem here, and it's a big one. It's a complex problem, but thankfully, Sherletta doesn't just leave us hanging, right?
Thankfully,
She actually offers some solutions.
Yeah.
And some of them are really, really interesting. So first of all, she talks about virtual support groups,
Okay.
which is, that's pretty huge, right? Especially if you're in a rural area
Yeah.
or maybe transportation is a challenge for you. So virtual support groups can really be game changers for people.
Definitely.
And she even mentions specific organizations like Sisters Network Inc. and Latinas Contra Cancer, which are both doing amazing work,
Mm-hmm.
providing that targeted support and resources.
Yeah. You know what I love about these virtual platforms is that they kind of break down all those geographical barriers, right?
Exactly.
And it allows, for people to be anonymous, which I think is really helpful, especially if they're a little bit hesitant to share their story so openly,
That's a really good point. Yeah, I didn't even think about that.
But, we also can't forget about the digital divide.
Right.
So that's, making sure that everyone has access to the internet, to computers, and also has the digital literacy skills to be able to participate fully online.
Exactly. So, it's not just as easy as going virtual and assuming that everybody's going to be able to benefit in the same way.
Right.
There are these underlying inequalities that we have to think about and address. And it's also important to think about, what already exists in the community.
Mm-hmm.
And Sherletta talks about faith-based support, which can be such a powerful source of, support, both emotional and practical.
Yeah, absolutely. Think about it. You've got these churches and other faith-based organizations, And they're already providing a lot of things. They're
Well,
providing meals,
right.
they're providing transportation, childcare assistance.
So why not leverage those existing resources to also support women who are facing breast cancer?
Yeah, yeah, that just makes so much sense, right?
Absolutely.
Yeah.
It's about, recognizing what strengths are already present in these communities
Right.
and building on those strengths.
Exactly. And it's not just faith-based organizations. She also highlights the incredible work that's being done by, all kinds of community organizations.
Yeah.
Like she specifically mentioned phenomenally Women's Society, which
Oh,
I thought was really interesting. And, these groups are so vital because they have that deep understanding
right.
of the very specific needs of their community.
Yeah, they're really on the ground
Yes,
working directly with the women who need it most.
exactly. And then another really important piece of this puzzle is peer support.
Yes,
So, professional guidance is essential, of course.
of course.
But there's just something so incredibly powerful about connecting with somebody who has walked a similar path.
Somebody who truly understands what it's like to face breast cancer as a Black or brown woman.
That empathy and shared understanding is it's invaluable.
Yeah, it really is. It's about seeing yourself reflected in somebody else's story.
Hmm.
It's about finding hope.
Yeah.
And it's about realizing that you're not alone in this.
And just that realization that I'm not alone can be so powerful,
Why so?
especially when you're dealing with something as overwhelming as a cancer diagnosis.
Yeah, it's about validation.
Yeah.
It's about shared experiences. It's about remembering that there's strength in vulnerability.
Absolutely. It's about breaking down that stigma that so often surrounds seeking help.
Yeah,
It's about creating a culture of support and connection.
yes, exactly. Exactly. But, even with all of these amazing organizations and resources out there and all of the incredible work that they're doing, Sherletta reminds us that we can't just rely on these individual solutions. We
Mhm.
need to address the systemic issues, right?
We absolutely do. We need to see those policy changes that really address the root causes of these health disparities.
Yes, exactly. We can't just offer Band-Aid solutions,
Right.
We have to think bigger, and we have to be willing to actually dismantle the structures that perpetuate inequality in the first place.
Absolutely.
It's about creating a system
Yeah.
that prioritizes the health and well-being of everybody,
Right.
regardless of their race or ethnicity. It's about recognizing that true equity requires more than just good intentions.
He does.
It requires real action
Yes.
and dismantling those systems that are keeping people down. And we'll dig a lot more into what that looks like in the next part of our deep dive.
And it really does require, like you said, moving beyond simply acknowledging the problem,
Right.
and actually taking those concrete steps to actually make that change.
Yeah, exactly. And that's where Sherletta's call to action really comes in. She challenges her listeners to go beyond awareness and actually do something. It's not enough to just know about the problem. We have to actually be part of the solution.
Right. It's about channeling that energy into action.
Exactly.
And, it doesn't have to be this huge, overwhelming thing.
Right.
Any action that you take, no matter how small, can contribute.
Absolutely. And she gives a bunch of really practical ideas of things that people can do.
Oh, yeah. Like what?
Well, first of all, sharing the podcast is always a good start.
Yeah.
But she also talks about using specific hashtags,
Oh.
like hashtag Phenomenally Me podcast,
Okay.
hashtag Health Equity Now,
Mm-hmm.
hashtag Black and Brown Strong.
I like that.
Yeah, and she says these hashtags can really help amplify the message.
Right, because it gets the conversation going.
Exactly, and it helps connect people to this larger movement.
Yeah, I love that.
So it's about leveraging the power of social media for good, right?
Yeah.
But then she also encourages people to get more actively involved. So, maybe donating to organizations that are supporting these women, maybe volunteering your time, or even partnering with these organizations to host events.
That's great. I love that she's offering all these different options,
Right.
so people can kind of figure out what works best for them.
Yeah, exactly, because not everybody has the means to donate a ton of money, right?
Right.
But maybe you can volunteer an hour a week or use your social media platform to spread awareness.
Mm-hmm.
It's really about, recognizing that every action, no matter how small, it really does make a difference.
It all adds up.
Yes, exactly. It's about that collective responsibility. We're all in this together,
We are.
and we all have a role to play.
We do. One thing that really stood out to me when I was listening to this episode was,
Yeah.
okay, so Sherletta focuses mainly on, the experience of patients, right?
Right, right.
But she also briefly mentions how important it is for loved ones to provide support,
Yeah, that's such a good point.
you know?
Yeah.
And I think it's easy to get so caught up in thinking about what the patient needs
Right.
that we forget about the people who are supporting them.
Right, exactly.
They need support too.
Yeah, and as I was listening to that, I was thinking, like, what does it actually look like to be a good ally in this situation?
Yeah, how can we really show up for our loved ones,
Mm-hmm.
especially when they're facing, all of these systemic barriers on top of everything else?
Yeah, exactly.
It's such a crucial question.
It is.
And I think first and foremost, it's about education and empathy, right?
Okay.
We have to really understand, those unique challenges that Black and brown women face.
Right.
We need to understand the systemic barriers
Mm-hmm.
and how all of these things just create this like so much more complex and challenging experience for them.
So it's not enough to just offer a listening ear,
Right.
We have to be
We
informed,
have to be informed.
and we have to try to understand the nuances of their experience.
Absolutely. Because their journey isn't the same as, a white woman's journey.
Exactly.
And there are all these different factors that play into that,
Yeah. Right.
their race, their ethnicity,
Yeah.
their socioeconomic status,
Mm-hmm.
their access to healthcare.
Yeah. Yeah. All of those things.
So how do we, move from awareness to action?
Right. What can we actually do?
What can we do? Well, like you said, active listening,
Okay.
really listening to what they're going through
Yeah.
without judgment,
Mm-hmm.
without interrupting,
Yeah.
just being present,
Yeah. Validating their feelings.
Yes, validating their feelings.
And acknowledging, the challenges that they're facing, both, in their personal lives
Mhm.
and because of the systems that they're navigating.
Yes, exactly.
It's about creating that safe space,
Yeah.
where they feel heard and understood
Right.
and supported.
And I think it's also important to ask, what do you need?
Right.
Instead of just assuming that we know what's best.
That's such a good point.
Because support really isn't one size fits all,
Right.
For some people, maybe it's practical help, like driving them to appointments,
Mm-hmm.
helping with childcare, cooking meals.
Yeah.
For other people, maybe it's more emotional support,
Right.
just being there to listen, being
Yeah.
present.
Yeah. Sometimes the most powerful thing you can do is just be there, and just hold space for them,
Totally.
trying to fix things.
Without offering unsolicited advice.
Right. Right. Exactly.
It's really about recognizing that their feelings are valid,
Yeah.
regardless of whether we, understand them or agree with them.
Exactly.
It's about meeting them where they are
Yeah.
and offering support without judgment,
Mm-mm.
without any expectation.
And it's also about understanding that being an ally goes beyond these individual actions.
It does.
It's about advocating for systemic change,
Yes.
It's about challenging policies that perpetuate these health disparities.
Mhm.
And it's about holding the healthcare system accountable for providing equitable care.
Absolutely. It's about understanding that all of our actions, both individual and collective, have the power to create change.
Yeah.
And that's a really powerful thing.
This deep dive has really been, I don't know, like eye-opening for me.
Yeah.
Just thinking about the role that community support plays,
Mhm.
especially for, Black and brown women who are facing breast cancer.
Yeah.
It's just so important.
You did.
And then, thinking about all of the systemic barriers that are in place. And, thankfully we talked about some of the amazing organizations that are out there doing this really important work.
Yeah.
Providing these culturally specific resources.
Absolutely.
It's a complex issue, but,
It is.
I think what I'm really taking away from this is a sense of hope
Yeah.
and a call to action,
Yeah.
It's easy to feel overwhelmed by all of this, right?
Oh, absolutely.
Like, how do we even begin to address these huge systemic problems?
Yeah.
But I think this episode really reminds us that
Mhm.
even small actions can make a difference.
They really can.
Whether it's donating to an organization or
Volunteering.
our time
Mhm.
or having those sometimes really difficult conversations about race and healthcare,
Yeah.
or even just being more informed and
Yeah.
supportive friends and family members,
Yeah.
every step that we take really does contribute to this larger movement
It does.
for equity.
And that movement is growing,
Yeah, it is.
It's really inspiring to see so many people, from healthcare professionals to community organizers to just everyday people, really coming together to try to make a difference.
Yeah, it's really amazing to see, and I think at the end of the day, it's not just about breast cancer, right? It's
Yeah.
about creating a world where everyone has the opportunity to thrive,
Yeah.
no matter who they are, no matter their background, It's about recognizing that health is a human right.
Yes.
And access to quality care, you know, that shouldn't be a privilege. That should be something that everybody has.
Everyone should have access to that, absolutely.
So as we wrap up this deep dive,
Hmm.
I think we just want to leave you with a challenge.
Okay, I like it.
You know, what resonated with you most from this episode?
Yeah, what are you thinking about?
Yeah, what sparked your curiosity?
Hmm.
What action will you take? Because
Yeah.
we can all be part of the solution.
We can.
Yeah.
Don't let that feeling fade away.
Right.
Let it fuel you and
Yeah.
inspire you to make a difference.
Yeah. Remember, even small actions, when we all do them together,
Hmm.
they can lead to big change.
They can.
So thanks for joining us on this journey.
Yeah, thanks for being here.
Until next time, keep learning,
Keep learning
keep questioning.
and keep pushing for a better world for all.